do your part and you're doing an awesome job. We're gonna do our part as a district by saying, if you got a sick kid at home with, you know, or a sick parent or sick grandparent in the house, let's just not run the risk of sending that child to school like we would have sent my son 2 days before he was, you know, he couldn't even get tested, right, until 5 days after the first positive in the house. 4 days, 4 or 5 days. So, you know, we could have sent him Wednesday, Thursday, Friday. He still would have been asymptomatic. At what point did he start being able to transmit that? I don't know. But, you know, I'd rather be proactive than reactive, and I don't see it as a huge lift as a district to say, we're going to go a little bit step farther and ask that, or require students to wear masks if you have a positive case in your house. Or do we go so far as to say, if you have a positive case in your house, we want the middle school, high school, elementary school student to stay home until they have a negative test. And I get that we're gonna have 3% of people who just don't ever get tested, right? That's just the reality of it. But having a policy might help it make it easier and a little bit more clear cut for the other 7% who might be on the fence about something. And it also shows as a district that we're doing our part through policy to hold up, you know, our end of the prevention when staff are busting their butts to keep the school as clean and safe as possible.
And here's where I think, and I don't know, Jim, this is my understanding of, some of it we just can't, like legally, we can't say, yeah, we can't require them to get tested, can we?
I mean, we can require the mask side, the only, outside of the COVID side, the only real problem we have too is the fact is there's no way Molly can track that. It's just try to keep track of all the students, where they're at, with the number of days. Because the problem we run into that I saw from last year is that if somebody has it, and some people follow, some people don't, then that's when you really start getting the finger pointing and that kind of stuff going on. And to put that on Molly, or even the principals, to try to keep track of who has what, or how many days, what day can they be back unmasked, that kind of stuff, it really, it's a logistical nightmare trying to figure that out. But everything you've saying is spot on. It's just a matter of having the manpower to police that essentially. Because anything you do above and beyond, or changing what we're currently doing, then how do you patrol that? How do you have that? Because individual kids and families will do that, and then that's when the finger pointing pops out if someone isn't following that and that kind of stuff. And I don't know how do you avoid that without causing more problems. And unfortunately, like you say, with the nutrition side of what we mandate, for whatever reason, people have drawn their line in the sand on the mask thing, and I have no idea why. Because it's, you know, it's not the first time in human history we've gone through pandemics and dealt with stuff, but for whatever reason, this is such a hot topic.
Yeah, and that's where, you know, I don't know that I'm suggesting at this point that we consider, from an administrative and a prevention standpoint, that everyone be masked, to simplify that, right? Because then I mean, you're right, it's a big enough administrative burden for you, Juanita, Molly, the principals, to track who's out and when are they coming back. I mean, that part of it alone is an administrative nightmare. You know, with even a handful of kids at a time, it's crazy. So, you know, I guess that would be one way of saying, well, this way we can avoid creating an absolute nightmare and an untenable situation for administration in tracking, you know, the mask wearing and that, and just say, let's just put everybody in a mask.
Isn't there kind of a middle ground where, back to your original point with talking with Molly, that, you know, in that case, we've got, you know, it's in the house and somebody's asking, wouldn't there be kind of a middle ground where, say, you know, we would really request that you not send your kid until things are cleared up at home? And that's not really a mandate.
Or go back to what are the CDC guidelines? I mean,
Yeah.
can we
Well,
at least allow Molly to say, here's what the CDC says.
And she does. I mean,
Okay.
because that's part of, we read in with what we have for our opening plan was that highly recommend people follow the CDC, Minnesota Department of Health guidelines for COVID and following that. You know, we still have a number of students in both, or actually all three buildings that are masked when they come to school. There's no question about it. So, they're following it. It's just that, people are picking and choosing what part of the CDC and the MDH rules to follow.
We're all experts.
Right, I mean, that's what it boils down to, I mean, because the CDC, if we were following what they recommend, we'd be masked. Everybody, adults, students, everybody would be masked up, vaccinated or non-vaccinated.
I think the other thing, Joe, too, like, I think I think you're right about that, we definitely need to encourage people, if they have it in their household, they need to stay home. But back to your comment about the mandates with the food stuff, those are like state mandates or federal mandates, and unfortunately, we don't have that support on any of this in the COVID world. Like, we don't, I mean, last year we did, but the Safe Learning Plan, thank goodness, is no longer around. And we don't have the support of that, and I keep going back to, as soon as my son leaves this building, he can go to a Vikings game with 60,000 people and no mask. And I just can't see us forcing people to do that kind of stuff when they can walk out the door. And, I mean, I think we can continue to encourage, which I feel like we have done a very good job. But I have a really hard time with us forcing or mandating things when, as soon as they walk out of this door, we have no support. You know what I mean? Like, you know, there's no support from the state, I mean, there's the CDC recommendations and Department of Health, but there's really no support outside of the school to help us try to keep these rules in place. You know what I mean?
Well, there isn't, but there is, in the sense that, you know, if we were to say, we're gonna follow the CDC recommendations, which is we're going to ask everyone to wear a mask, vaccinated or unvaccinated. So if that's the recommendation from the CDC, that's what we are following, because we think that's in the best interest of our community. We may not have the state, not that I'm looking for their support at this point, because it's become a political football, or the federal government. But, you know, I also don't, I wanna feel like we're doing the right thing, whether it's politically correct or not. Whether, if we believe it's the right thing for our students, for our staff, for our community, I wanna be able to do that whether the state says, yes, you have to do that. I don't wanna have to feel like I'm wiping my hands of it and saying, well, we have no choice, the state's making us do it. If it's the right thing to do, we should do it.
I'm gonna say, you know, I kind of agree with you there, Joe. You know, if you take politics out of the equation, which obviously it has become political, and you look at it from a public health standpoint, you know, do the right thing. And, you know, whether that's, you know, either suggesting everybody in the school wears a mask, or, you know, at least families who have tested positive, keep the kids home, and if they aren't presenting symptoms after X number of days, still wear a mask. You know, there's gotta be something, you know, I don't know what that is, but, you know, you don't wanna get to a point where it's like, you're reacting, you know? You don't wanna get
At this
there.
point, there's no question about it, I mean, with what we have, you know, and.
You don't wanna get to a point though where you have 10% of people
Right.
out sick.
Right, yeah, I mean, we would mask up prior to that, you know, and what makes it difficult is the whole social aspect of what we're dealing with. I'm sure all of you have seen the stories of the board meetings and everything else that go on, all that kind of stuff, and we've been fortunate here that, you know, calmer minds, I guess, have prevailed, you know, through our discussions, but, you know, it takes one, what I would call crazy, to come in because of something we've done, and puts people, you know, so outside of COVID, puts people's safety at risk, type thing, you know, and you know, it's no secret, there's articles out there about board members are falling left and right at a record pace of just quitting because of all the pressure and everything else that's going on with this, and so, you know, unfortunately, if I was just dealing with COVID, that would be pretty easy to deal with. It's
Yeah.
just everything else that comes with it, all other crap that makes it really difficult. You know, and, you know, in doing the right thing, you know, I'm not opposed to doing any of that, because I had to face that in a state that's much redder than the area we live in now. dealing with masks and all that kind of stuff and facing that. It's just one of those things where, because it was, essentially, whether people agree or not, I don't think anybody will disagree that the whole process of what we've gone through was just screwed up right from the get-go. And so right now, because of the lack of trust of everything, because what I find ironic with government officials is they want all the praise and the popularity, but they don't want the heat that comes with it when there's some tough decisions that have to be made. And they didn't wanna do that, and, unfortunately, we're in a society now that you don't know what to believe anymore. And so we're stuck trying to do what's best for our kids, despite what I describe as the derelicts that are at the state level and at the federal level. And it really puts a lot of undue pressure on what we're trying to do, because I think I told you, Bridget, I can't imagine if my job just meant I get to, walk in the buildings and critique instruction, work with kids and do all that kind of stuff without everything else.
What you actually went to do for your job.
Yeah, what I actually got trained to
Yeah.
do, that's the part that's hard, and, I'm fortunate for my spouse, she worked with that directly, in Wyoming, so she and I constantly are reviewing and looking at different information that comes out and determining that, and I wish I could give you a better answer and a more concrete of thing that we're trying to be more proactive. With the idea of knowing that because it's a relatively quick turnover, we can make decisions before we get to the point where we're too reactive, I guess is a better way to describe it, and from that aspect. But with what you're talking about within the family, that's certainly something that I reviewed Molly and the admin, and we continually talk about where it's at, what's happening, and that kind of thing. Minnesota's fortunate because we have the healthcare system we do have, and the medical resources that we do have. We're very fortunate that, I'll tell you what, Minnesota is rather educated well when it comes to the medical side of stuff, so we're fortunate from that aspect, because I was from Wyoming, not so much. Some of the discussions we had at board meetings and what people brought in, you wonder where the heck they found this information from. It was just it made no sense whatsoever scientifically. But no, we'll keep monitoring it, and, at this point, unless I get an influx of 3 in one day or 4 in one day, I haven't been sending them out to the board, other than we've just had, right now, I think we're at 10 or 11 total so far. So we've been, I've considered of our student population, that's been pretty good, of the ones we know about, type thing, Is it higher? Probably, I don't question that at all, but at this point, I can only go with what I know, what I've been informed on,
Sure.
for a recommendation for the board.
No, that's, and I can't say enough how much I appreciate all the diligence from you and your office and admin and staff at coming together around this and thinking through everything. I mostly wanted to throw that out as a personal experience for the board, and also as we go down this line, we haven't had angry mobs at the meetings yet, and I don't want to draw that upon us, but I also want, and I believe this very strongly, this board will always do the right thing for staff and students. Absolutely believe that. But I wanted to have the conversation around proactivity versus reactivity, and just so that we all start to think collectively around what are we willing to do or ready to do should that situation arise. And I think it's an okay thing, or a healthy thing for us to at least talk about what measures we may have to confront. Because we've been very fortunate from an outbreak standpoint since the very, very beginning.
Right.
More so than a lot of districts have. And while I'd love to think that will continue, my family got really lucky for 18 months, and then, in 3 days it was, we can only spread so much lamb's blood over our door before it comes knocking. So, as a district, that's,
Right.
as long as we have students and staff in the building, right, the time will come, when those numbers at some point, despite our best efforts, start to go up, and I just wanna make sure that we as a board are okay having those tough conversations. Cause I don't wanna bring hell's fury upon the principal's office or upon your office or upon anyone's car outside a meeting. But, cause unfortunately, it has happened in a lot of places.
Right.
Well, and I've said from the get-go, Joe, that my priority, and we said this when we had the meeting with the public that did come about the mask mandate, that our priority is having students in person in the buildings.
Yes.
And so if it comes to it, that we had to have a mask mandate, I will vote for it. Because that is I want the students to be here as much as possible. I do think it is worth looking at those guidelines that we're giving parents as well. You know, if at some point we need to tighten those up a little bit too, because obviously keeping a case out of the school is better than, is better defense than a mask, right? If they're just not even here. So if that comes to that point where we need to start tightening things down, to Joe's point, I mean, what you're saying is, let's start to think about what our strategy would be, and I'm all for those things to,
Well, the date that I'm really watching is Halloween.
yeah.
Because, that was when it really hit hard in Wyoming, is after Halloween, people went out with candy. People,
Parties.
well, not necessarily the parties, what we found is that a lot of people, because everybody's touching the candy, and not washing their hands after each thing that they touch, that we had a huge outbreak, right after Halloween there, so the big thing we're gonna try to get out as a message for people is to make sure you know, wear gloves when you hand out the candy, that kind of stuff, so you're not spreading it around. Cause then that's where it festers, cause then it sits in your house, you're touching everything, everybody's touching everybody else and all that kind of stuff, and so, Halloween is my fear based on what I saw when I was in Wyoming.
And that kinda happened here too, because it was
Yeah.
the second week of
Early
November.
It was November when it started ratcheting up.
It's also when it gets cold and everybody starts being inside.
Yeah, it's kind of both
Perfect
things.
storm.
Yeah.
For them, so.
And we've been fortunate with the weather, because everybody's been outside for the most part,
Yeah.
I mean,
Yeah.
that certainly has helped. And once we get inside, it's even more, important for the sanitation and everything else. So,
Yeah, hopefully it doesn't happen, but in a month from now, it could be completely different.
Yep, absolutely.
Alright.
Only other thing is that we're looking at, because of with the election being on November second, right?
Yeah.
Of canceling the board meeting on November first and moving the meeting to a special meeting on, November eighth. Cause we have to canvass the election results. So then rather having two back-to-back meetings on 2 Mondays, put all under one, it's just that we can't add any agenda items to a special meeting other than what we have from our regular board meeting that we would normally have. So just thought I'd give you a heads up on that, so that way we can kind of not have to have so many meetings in the evenings, and spend more quality time with family and that kind of stuff.
So before we leave the COVID discussion, what kind of guidance are you getting from the, I'm trying to remember, what's the name of the body that, it's kind of like MSBA for the superintendents?
MASA?
Yeah, on this, OSHA regulation with the shots.
Yeah, that's the one that I'm
Yes.
also concerned about.
I don't know what it's like at, some of your other larger companies, but I know at mine, we got rolled out today, you better start showing us your card or you're getting tested weekly.
I think was it 4 districts right now in the state that have required vaccinations? Massa is, the advice they're giving us is the wait and see thing, because they're waiting for lawsuits to come with that, if they do come. I think that overall, from the teachers' union, I'm just speculating, I have nothing to base this on, but that for the most part, teacher unions are in favor of them, because you haven't heard of any, lawsuits yet, but I'm sure at some point somebody's gonna file a lawsuit against that, as far as their personal rights. You know, and
Well, it'll be interesting to see when he rolls it out, because it's currently 100 employee plus, but
Yeah.
will that include schools, will that not include schools?
It's-
I don't think
it's
it's so
plain-
gray right now that
Well, the guidance that we got from the Department of Labor is it's employers
any
of 100,
100 or more, that's
100 or
it.
more. There's no caveats or anything to it.
Yeah.
And it's gonna have OSHA compliance, come knocking on your door about it.
so yeah, so we're watching that one really close. That might be on our agenda for November.
Because what's the drop dead date, like December 8th, I think?
You know, I don't remember,
I,
but I know, I mean, they've got, these larger companies are worried about it
Well,
beyond,
they don't have they have to hire people to manage it. I mean, just the
Yeah.
cost of running the testing weekly, the cost of
People are
employees.
just gonna walk.
Yeah.
well, and whether the fine's gonna be for every instance, and
Yeah.
Right.
is it on a daily basis? I mean, nobody knows any of that
Well,
stuff, but,
and you're seeing employees saying, fine, I'm done, I'm
Yeah.
walking away.
And we did get a
And we already-
notification that there is for 12 to 17 years of age, there's if they get vaccinated between now and November,
$200.
$200 gift card, and then there's,
That came out
Five.
today from Walls.
yeah, from Walls, and there's 5 $100,000 scholarships. They're gonna randomly select all kids between 12 and 17 who have been vaccinated. If they want to, if they win this $100,000 scholarship to pay for their schooling, but they have to attend a school in Minnesota, private or public.
Is that kids who were vaccinated?
Yeah, I was like, wait, my
Yeah,
kids.
like-
Yeah, like-
Those kind of
like
things go,
before
wow,
or-
wait till you use that one.
That includes all 12 to 17, whether they were vaccinated during that time period or before.
Okay.
Oh, really?
But only kids eligible that I could tell based on the letter was that if they were vaccinated between October 18th and November 30th, they're eligible for that $200 gift card, Visa gift card.
but they're all in the running for the 100,000?
Yeah,
And everybody's in the
hopefully.
running for the 100,000.
All right.
we should maybe get that out.
Yeah.
That might be a good incentive.
Yeah.
Yeah, so other than that, things are moving along. So, at this point, we've done 50-something walkthroughs with staff, been meeting with a number of different positions as far as looking at what we're doing and why we do what we do and what we need to do to be better.